Hi, I'm Andrea, owner and senior podiatrist here at AC Podiatry. Today, I want to have a conversation with you guys about one of the most common presentations we see in our podiatry clinic, and that is bunions. So the first question, I guess, is, well, Andrea, what is a bunion? Well, a bunion is effectively a bump that occurs at the base of the big toe, generally caused when you get a movement or a misalignment of the big toe across. I'm sure we've all got a grandma or grandpa that actually has that particular deformity, okay? Now, when you get a bunion, it can be really quite painful, okay? It can prevent you doing the things that you want to do by virtue of the joint being limited in movement, cause redness, obviously pain, and even at a base level, stop you wearing the shoes that you want to get into. Now, a lot of people say to me, well, Andrea, I've got a bunion, but what causes it, okay? Well, genetics are a big cause. If mum or dad has a bunion, chances are you're going to be at risk of getting a bunion. Obviously, poor or faulty foot mechanics. So if your foot doesn't work properly and your big toe joint doesn't work as it should, that repetitive stress can cause that deviation to occur. Repetitive activity like dance, so ballet, up on point or demi-point, will put a load through the big toe, and over time that can cause it to deform. Or even just poor ill-fitting shoes. So the old pointed toe on the stiletto causes that to come across, and over time will cause that bony deformity and change. Now, lots of ways of treating them, and I guess the first way would be non-surgically. So what can you do if you've got this bunion to kind of help out? Well, non-surgical interventions, things like footwear, so getting into a nice broad shoe which gives the foot room to operate in, it works. You can get over-the-counter pain medication, ice, even using things like splints and paddings to kind of keep the toe straight, be it overnight or during the day, can, and we know because evidence, can limit and reduce the pain in that particular joint. Sometimes though, it's a little bit more extreme, okay, and it's actually impacting on your activity. And it might be that we need to look at something like a custom-made orthotic device to get in there and actually get the foot working better, or get some hands-on manipulation or manual therapy to actually improve the way the joint moves, and by doing so reduce the pain and disability that comes from having a bunion. Sometimes though, conservative treatment won't work, and we've got to look at other options, and one of those options is obviously surgical intervention. Now, surgery is not what it once was, okay? There are surgeons now doing minimally invasive or keyhole surgery for bunions. And what this means is that recovery time from bunions is not the many months it used to be, but it's now in the period of weeks to a month. So that's a fantastic development in surgery. So it shouldn't be something that's as feared as perhaps it used to be. The other thing about surgery is what you're trying to do with the surgical intervention is improve the overall function of the joint. So yes, we want to straighten it, but we also want the joint to work better so that you can go back to doing the activities that you want to do. Now, it's really important that whether we're looking at non-surgical, orthotic, over-the-counter, or even surgical intervention, it's essential that you have a proper diagnosis and assessment, okay? Now, any good qualified podiatrist should be able to do this. I'll undertake a good assessment, probably send you for some x-rays to examine the joint, okay? Be able to put together a treatment plan. And if it is so that you need potentially a surgical opinion, set that up for you, refer you in the right direction to get that done, okay? So hopefully this little video has taught you a little bit about what a bunion is, how it happens, what we can do to treat it and manage it, and giving you some confidence in moving forward to tackle the issue. Now, if you know anybody who has one and you think might, get something out of this video, please share it and pass it on. Or if there's anything that you'd like to know from me or the clinic, call us, put a message down below, message us directly, not fast, but we're just here to help you, and we're here to help you keep on your feet for as long as possible, all right? So with that, I'm gonna let you go. Thank you so much for listening. Stay well, stay on those feet of yours, stay healthy, and I'll talk to you soon. Okay, bye.